So midwives are like doulas, right?
No, midwives are not doulas. While midwives share similar roles to doulas, they are different. Doulas are labor support people who are trained to continuously deliver physical, emotional, and informational support to a mother before, during, and shortly after childbirth in order to help her achieve the healthiest, most satisfying experience possible. So while midwives enjoy the process of labor coaching and filling this role in some ways, this is only part of what midwives do.
So are midwives nurses?
For the most part, yes. There are two types of midwives, nurse midwives and direct entry midwives. Both sit for the same boards exams and become licensed certified midwives or certified nurse midwives respectively. Both degrees require at least a master's level of education. It's important to note, though, that certified midwives, or CMs, are only recognized in 5 states, while certified nurse midwives, or CNMs, are recognized in all 50 states, Washington, D.C., and most territories.
But midwives just do labor and delivery, right?
No, midwives care for women from menarche to after menopause, with any and every pregnancy in between. So yes, we take care of women during labor and delivery, which we call the intrapartum period, but there's much more than that. Midwives do full spectrum obstetric and gynecologic care. So what this means is that we do well woman visits, we see women for gynecologic issues that arise, and we offer a wide range of family planning options. Midwives are in the business of providing women with opportunities to take care of their body. So this encompasses a lot more than just the pregnancy time period.
Aren't midwives witches?
Believe it or not, European history often confuses the practice of midwifery with witchcraft, but no, midwives are not witches. This misconception is too complex to delve into in this video. In short, people didn't used to have healthcare like we do now. Women were expected to be healers. They were herbalists and used knowledge handed down from generations of women before them, of plants and minerals and concoctions to create in order to heal various ailments. When medicine came around, a field dominated by authoritarian men and other historical factors at play that we won't get into, a lot of women were seen as witches. And because midwifery is a field inhabited mostly by women, in medicine, a field dominated mostly by men, the authority struggle still exists and people still confuse practices of midwifery as modern-day witchcraft.
So midwives are doctors.
No. While midwives have a similar role as healthcare providers, they are not medical doctors. For one, their education is different. MDs typically get a bachelor's degree with required math and science courses, and then they go to medical school for 4 years. Then they do a residency for 3 to 4 years in OB/GYN for that specialty. Most midwives go to nursing school for their bachelor's degree, and then they go to midwifery school for about 2 years. Some midwives have a doctoral degree, but it's a doctorate in nursing practice, not in medicine. The philosophy of most OB/GYNs is a little bit different than midwives as well. They see bodies, and specifically pregnancy, as pathologic, while midwives recognize that pregnancy is another body condition that most women will experience. Because of this, midwives care for women with normal physiologic births. We manage high-risk patients, but there are certain conditions that we're not qualified to provide care for. For example, midwives don't do C-sections, and they typically don't manage births of multiples.
But midwives do home births, right?
Yes and no. In certain regions of the United States, midwives are trained to deliver babies at home. This is mainly isolated in the Northeast. In all other regions, midwives are not really trained to deliver at home, and most insurance providers won't cover any medical provider delivering outside of a birth center or a hospital. Midwives are educated about birth outside of the hospital, but this is mostly about birth centers and not about patients' homes. So therefore, midwives work mostly in the hospital setting, birth centers, and clinics.
So let me get this straight. Midwives are part doula, part witch, part nurse, and part doctor? Okay, maybe not, but now I know that CNMs are licensed independent health care providers with prescriptive authority. They provide a full range of primary health care services for women from adolescence beyond menopause. These services include primary care and family planning services, preconception care, care during pregnancy, childbirth and the postpartum period, care of the normal newborn during the first 28 days of life, and treatment of male partners for sexually transmitted infections. Midwives are with women for a lifetime.